online too, or, okay, perfect. So, calling the meeting to order, it's 5:30. And so we'll start with the approval of minutes on June 19th. And again, thank you for taking our minutes. Um, does anybody have, yes,
I would offer a couple of corrections to numbers on the second page. I don't know what's significant and what isn't. So just, tell me if you don't think it's worth it, but should I proceed?
yeah, go ahead.
If you go to, second page, starts with my name, Stephen. 3 bullet points down is discussion. Under that, 4 bullet points down is consensus reached by committee. The first point under that says we will fundraise through 2026 requiring 43,000. That should be 35,000.
Okay,
That's the first of 2. And then the 4th black square bullet, I don't know if those are bullets, says in its second line, 2 voters at March 2027.
Yeah.
It's actually 26. I believe, to the best of my knowledge. That's it.
so it'd be March 2026 for the 2027 fiscal year.
Yeah.
Yeah.
Okay. Any other additions to propose for the edits? So do you want to make, I'll make a motion to accept those edits for the 35, from the 43,000 to the 35,000 under consensus, and then the March 2026.
Second.
All in favor?
Aye.
Okay, so do we make amendments to the, so how does that, if we?
Nope, you
voted to-
approved
Yep,
the amendments and.
Yep.
So that's, just, we don't have Sheila here, she has not arrived yet, so we may want to consider minute taking for this meeting.
okay.
Um,
So we have the motion to approve the minutes, so we can just talk about now who will take a minutes for our meeting right now. And I don't, if Sheila hops in, I think it'll be too late for her to take minutes. So does anyone want to? I also will take some minutes so I can add to that as best as I can.
I will do that.
Okay, thank you. Thank you. Thank you. Okay,
I wasn't really paying attention, so I did make the note of.
I'll send you those. Yeah.
And
I have the updates, I'll get those updated and posted immediately, don't worry about those updates.
I got the numbers. I don't,
Yeah.
you made the motion, right?
Yeah.
Bill and Steven seconded.
Yes,
Okay,
correct.
that's what I was not paying
Okay,
attention to.
perfect.
She made the motion to accept the minutes as.
Accept, yeah,
amended.
perfect. Okay. All right, so let's get into the order of business. So, I'll start off with fundraising, and I thank you to Cindy for, suggesting just some of these bullet points. And if we don't have discussion points for these main topics, then we will not have them, but it just so happens that we do. So we'll start off with fundraising, and I'll turn it over to you, Steve.
Well, you all saw the fundraising plan, that I sent to Emily, that's in your packet.
Yeah.
I simply tried to summarize the results of the last meeting. I did add a few, I think, non-controversial things, but, if you have questions, let me know.
So,
What was added, Steve?
Number 5, number 6, I guess, number 4. Number 3 says, and this is factual, we need to raise roughly 35K. I think it's just my judgment that if we're gonna have a fundraising campaign for 2 years, let's go for 50 and
Yeah.
we'll have a big party if there's money left over, but, that's all I'm saying in number 4.
Mhm.
Um, I think it's clear we want to approach burn. I was just trying to kind of be specific about anything I could so that, could see where the process was going. And then number 7, we talked at some length about, an informational / fundraising flyer, is that the right word?
Yeah,
Going out, I
Yes.
think we agreed on November of
Yeah.
this year.
Yes.
Yep.
That little window between Thanksgiving and Christmas, slip it in.
When people wake up and don't.
Slip it out.
Yeah.
yeah. Well, any comments then from Steve's, document here and any of the additions? I assume for the donors, we'll just update it as we hear of other potential donors here that you have outside of what you've listed.
These
These are probably the ones that's
5 are
them
the sort of the
Major.
largest ones. There's the lions and or lionesses. I can't quite remember, there are others.
Yeah.
That we did last year.
Yeah.
My intention is to redo them. It happens, I'm already working on the Hope Foundation because Harrison Drinkwater, who did this all last year, was the person of record on that website.
Got it.
And he got the email several weeks ago that said, we need a 6-month report from you. So he emailed me and said, you need to do this. So I
Got it.
figured out with them how to get my name on it. And this morning I successfully did that, which was a huge accomplishment. And I submitted that report, beating the deadline by 1 day. That's just the last year now.
So question about that report. So was that something that the town, like, does the town have to be aware of that report too? Should we have a copy of it? This is for funding, right?
This is the Hope Foundation.
Yeah, for this program.
Yes.
Yeah, so
It's
does
a-
the town have to be aware of the report?
That's a good
Can you get a
question.
copy of the report?
I can't see why not.
Yeah.
I'll see if I can print it. It's all a website. It's a form on the
Yeah.
website. It's, about 3 sentences long,
Yeah,
but
just a,
my guess would be I can print the whole thing. And then scan it and send it to Emily and.
yeah, I think just for records, right?
No,
Since, yeah.
no, it's a good point. That went right over my head, but I can't see why.
No, I understand, yeah.
Unless it turns out to be a IT challenge beyond my capabilities, which.
Yeah, no, I think that would be my only suggestion for that is that we put it we file it for transparency so that it's available.
Yeah.
Emily, you had.
Yeah, I had the same question as to what was provided for a report, just based off of the discussions that the committee has already had, based off of data. So I
Right.
was curious what that was and making sure that it's shared with committee members, so everybody has that awareness.
Great.
The gist of the paragraph is, the question it asks is, how are you doing relative to what you said you were gonna do?
Yeah,
And in our proposal, we said, we estimated number of clients and number of encounters. So I reported on the 6-month number of each of those, which actually looked pretty good.
okay, that's
So I
good
didn't
news.
have to, fall on my sword with them.
So the data that we have been provided this past 6 months was helpful to complete that.
And in fact, what came in
Great.
from Emily on Monday was,
So I don't have any questions on the documents. Does anyone have any other follow-up questions on the fundraising plan summary? And then my last comment would just be, since some of us were not here in the last fundraising, is there a list of minor donors then that we could also just be mindful of? Since right now we're working as a whole group rather than a small committee for
mine, you mean private?
yeah, so because
Minor.
these are major donors, right? And then you said there's some that are minor or minor gifts, I guess, or smaller gifts.
Dollar amounts are not trivial on the private side.
Okay,
They're depending on whether Jake's was a corporate or a private gift, and I
Mhm.
don't know. I think there are three on the order of 2,000. And then it drops off.
Gotcha.
And there is a list.
we do have a list, okay.
There's a spreadsheet. Yeah.
Maybe we can just have that on file too, so that
It was
when,
turned over to the town.
oh, it was, okay.
Yes, it is.
So
on
we can
file.
have a copy.
Yeah.
I'd just love to see a copy. Okay,
And yeah, and that doesn't go public, right?
No.
Town has it, but that doesn't go
Correct.
public, yeah.
yeah, I just like to,
It can be discussed what has been applied to for foundations in the past and who has been asked as far as businesses and
Yeah.
things like that.
Anyone? I just mentioned the name Jake, so I named a donor just a minute ago. Is that poor procedure?
that I
Chris?
don't know, I
think
mean,
maybe I
no,
should-
it's in your plans, I don't know.
Well, I mean, I mentioned the Burn
Yeah.
Foundation, Red Cap.
We've said,
and,
we've
I'm
said
sorry,
burn before, we've said hope,
The Hope Foundation. These
Yeah, I
are
think-
Sort of
But
public.
those are
yeah, I
Those
think
are
those
public.
are,
I
groups
don't
that
know
always
that,
give money.
that Jake's is a foundation.
right,
So
right,
It's
I
not a
guess I'm just,
foundation, but it is listed on the website as a major donor, so it's
oh,
okay,
fair to say
okay.
that
okay.
there are some of them that are public, so.
yeah,
But
so,
I won't mention how much Cindy gave. I'll refer.
Correct,
Yeah.
yeah, no individual donors will
I
be
think-
brought to.
I'll tell you
I
why.
think I wouldn't have done that anyway.
What I could do is I could utilize what has been given to me by the town to create one punch list of what we have received from foundations, grants, et cetera, kind of as one. And then, what I can do is I can pool any of the quote unquote individual donations into just one pool of money. So we can say this sum of money is
Yeah.
divided among X donations for
Yeah.
various reasons. And that way it does remain anonymous as
Right.
far as, who has given what.
Yeah.
But that,
And I would second that. That would be particularly helpful to me. I would like to include exactly what you just said in the burn letter.
Got it.
Um,
That's why I was
To
asking for the
summarize how
list,
many-
cause, yeah, so that
I've
we
been
can,
told that, she cares about how much town support you're
Yeah.
getting. So to say, we raised $10,000 from 21 private donors.
Yeah.
Yeah, I
would
think
answer
the
her
number
question.
of private donors would be really helpful
Yeah.
for
great.
the town to have.
All right, well, I don't see anything that has to be voted on here, so I think we can move on to the next agenda item under fundraising, which is implementation. And then that's where we could start to talk about committee work and responsibilities, and when we say committee, I guess it's this whole committee that we have at the moment. I will also say, like, I will also add, like, although we have this bullet point, are we there yet to discuss implementation? Right, so if there's some initial, because that could be a longer conversation, or that could be dedicated for a whole, so I just preface it with that. I know we just want to keep it so that there's an order to how we know we would have to discuss implementation, but I'm not sure if are we there yet, or do we want to start that conversation? Are there some initial questions that we need to have? Do folks need some time to think about that? So just putting it out there.
Guess we need a plan for how to implement.
Right, before we can even dig deep into like who's gonna do what.
Right, and I know, we probably should, I don't know when the foundational, applications will be due. I know last time they were due at varying times, but that seems probably like an early thing we should do to see when applications for this next round of applications are due.
I'm not sure what we're discussing. Who's gonna do what? Is that?
Generally, not even just who's gonna do what, but how are we implementing fundraising?
So that's what needs.
What needs to be
as a
done?
committee, we should know what the deadlines are so that we know, like, hey, we need someone on this foundation letter who can do it. Like, that way we have it prioritized as a conversation topic.
Right.
Well, just speaking for myself, I would be willing to create the fundraising plan that you have all seen and informally approved. I have a draft of the burn letter. I spent 2 hours with Kristen Barnum today revising that draft. There's probably nobody in the Upper Valley who knows burn better than she does. I have some questions for Ed, about what his role is in that, but.
I
You have-
can, yeah, so
You have
he-
answers?
Yeah, so
Great.
he'll sign the letters as he did the last time. It also gives him the opportunity to review the draft. Give feedback if necessary for those instances. But then he would like to be the signer. He agreed with the amount generally for what you had proposed. So and as far as content, it's more provide a draft for his review and then go from there. So,
So. I can do that tomorrow. So I'm just going ahead doing these things.
Okay.
You tell me if you want
So,
something else.
no, I think so. I think it would be good to just have a timeline then as a group.
Right.
So like, so that we know what's happening this month, next month, and how we can contribute. Also, like, it doesn't have to fall all solely on your shoulders. So in case that there are some items that we would need to help step in. So maybe that's where we start is like, what are we looking at for
I think you're
timeline? Yeah,
proposing, right? I'm happy to take initial responsibility for the foundation applications. That's about 4 or 5. One of which I did last year, one of which is the Hope, which I already know about. I would be happy to have any committee member volunteer to take one or more of those. I don't know for sure. I think, where's my list? I know there's one other letter that I wrote, but I don't think that was to Landecker, and I don't think Ed signed that. So that was a slightly simpler process. So there may be 3 or 4 websites that we applied to. Hope, Geocon, Landecker. There's like with Jake's, as far as I know, Harrison's the only one who knows how he pulled that off. So I have regular copies with him, so I'll ask him how that went. So I'll be happy to take the initial pass, try to find out try to write down what that list is, what the deadlines are, and what the process is.
okay, great.
And maybe at the next meeting, we can decide, unless something has to be done, submitted between now and then.
Sure.
Who executes on each of those foundation applications.
That sounds reasonable to me. I think most of them will ask some kind of narrative, and I'm sure you already have had that prepared from previous ones that just needs to be updated. So,
Exactly.
okay,
All of those.
Yeah,
That we
they already
did last
exist.
year, there's something existing, at least a letter. Let me just write that down because things that I'm supposed to do need to get written down.
any comments or feedback on that? And I don't think we need to vote on it, so it's just a matter of conversation, so.
And let me just say, if you're thinking about volunteering, I did one of these last year. Harrison had already done another one and the overlap of the websites was very high. So I could just look at what he had done and cannibalize paragraphs kind of as needed and add a few. It's actually a quite simple process.
and just as a part of that process, making sure that as the committee, we understand like what has been submitted for, because the other end of that is me kind of giving the town offices a heads up, like, hey, we applied for the Emily Landecker Foundation. Could you please let me know if you see anything? And then that way I can make sure that I'm distributing that information, just
Yeah.
keeping everybody in the loop. But yeah, that way, if something is turned in
Right.
kind of between meetings.
So Ed signs it, so the town would hear from it. We would not hear from it before that. Technically,
So typically for, just to review the process, so if, once you submit a letter to say the Burn Foundation and the Burn Foundation says, yes, I want to contribute, and they send a check, they're gonna send a check to the town offices. And then it's processed there, and then typically what happens is the assistant town manager will say, hey, Emily, I received this, check for X amount, it's gonna be approved, it's gonna be brought forward to the Board of Selectmen on X date for approval. And then, once that's approved, then we count that as those donations received, so.
Right, but who's the point of contact when those grants get submitted? The Ed as a town manager or the committee? Who's overseeing it? So if, Steve is overseeing the hope or the burn and they have questions, who do they go to?
I would say anything should be addressed to the town.
Okay.
So there should be no kind of personal addresses put on things. It should all be put through the town. Most likely to the attention of Ed or Elisa.
So can we just clarify that to be sure so that we know like which one of them? Cause I don't foresee that they might, but we just want to make sure if they have that if it has to go through the town, then we know we're aware of that. And so,
Just a point of fact, the Hope Foundation did not work that way. The Hope Foundation website had Harrison's name on it, now has my name on it. When it came time for the update, Harrison got the email. I don't know, but I don't think I don't think they even have a contact
Right.
specifically for the town.
It would be me as the appointed town person, right, the town manager.
No, I know who it would be, but they don't on their website have, as far as I know.
well, that makes sense, because this was done before the committee
Right.
formalized, so that's why moving forward, we just need to be clear. What what does Ed prefer, what does the town say about that, because if they're requesting, let's say, and this is my point, not to say that we shouldn't be, but let's say there's an immediate question, and if the town doesn't get to that. And it's time sensitive for the grant purpose, I don't want us to miss out on something. So that's my concern is like, if Steve has prepared most of that information. Or one of us, would be, or even you, Emily, could be the contact, because I just feel like if there's immediate information, sometimes that happens with grants and. You don't get that to them, I don't want us to lose out on anything because of that, like, the
Yeah.
pain of like Ed received it, but he queued it and then. Didn't get to his email till the end of the week, but they needed a response on Monday, so. And not to say that Ed couldn't respond, but I think he would ask for committee. Input is what I would imagine, like
Well,
if it's specific.
Yeah, I
to-
guess, let me touch base with Ed, because I know Mascoma Lakeside Park kind of has their own process, but kind of a similar funding mechanism,
Yeah.
but I know that. Having been created as a formal town committee and having the money sent to the town, things of that nature, and having the town involved in that level. It would seem appropriate to have not, personal information of committee members attached to it, such
Yeah.
as a personal address and information. But actually having it kind of set towards the town, but I hear exactly what you're saying
Yeah.
in terms of making sure that someone's paying attention to that. So there's a little bit of, let's figure out who that should be and verify, because, committee members can lapse, or, like those have a time frame on it. And I can also see where perhaps, town manager may not see something such as a fundraising thing, so that.
Right.
Yeah, it's a good point. I'll
So
be sure to clarify.
the way I'm gonna interpret this discussion is where possible on a grant application. Include information that says, if you have questions, contact Emily, blah, blah, blah,
Right,
town of Enfield.
right,
Not sure that's possible or effective on all these different websites. But
yeah, no, I bring that up, cause a lot of this is relational, and so people work with, like, if they're familiar with Stephen's name, it's not to say that they wouldn't, but some of these are definitely I know that the town is involved, but a lot of these is relational, people can just tap Stephen and say, hey, you submitted this and that. So that might happen. I just want to make sure we know what to do in those cases, or we've set like a precedent, or we're clear on what that entails, because sometimes it could be a quick turnaround and, you know, so that's just the scenario I bring up, but I don't, maybe it won't happen at all, but it better to sort of be prepared than not. Cindy?
I think if we delegated him as the representative of the town committee to do the application, that makes sense, that he has established a relationship with the foundation as he's working through the application. And some of them are a lot more complicated than other ones, and he would be the most knowledgeable person about it.
Oh, yeah,
That's-
but the communication still will, like the formal thing is gonna be the town. It'll be Ed's name, it'll be Ed's signature, the contact information.
Right.
No,
Not the content.
no.
What?
What happened last, I mean, this is to be debated, but what happened last year was, if I remember correctly, only one of the grant applications did Ed sign. That was the Burn Foundation. I believe his reasoning, at least a lot of it, was that the town has applications to Burn all the time for different programs. So there's all this stuff going on with Burn. We come in, we ask for more money. He needs to make sure the dollar amount, the timing doesn't undercut some other program. I believe, he did not sign in any way the Hope Foundation grant or the letter to Landecker or the letter to Bar Harbor. He let us do that. I think the reason is A, the amounts were small, and B, they didn't conflict with anything else.
Sure.
That's,
So we need,
that's,
yeah, we need
all right,
clarification.
let's make sure that he continues to want to work that way.
Yes,
Are there-
yeah, because the ad hoc committee has now transitioned to a town committee, so we want to ensure from his point of view whether that's gonna flow the same. or not. Yeah,
Yeah, so my question is, are there any other foundations he knows of where he wants to sign it or see it or be involved in any way?
well, he needs the information to know, so if you're saying that there are online applications that he's not going to be able to review, then it's hard to ask for his, it's,
He could review them. I can, at the very least, I can give him my login ID or password. Probably more straightforwardly, I think you can print them. So, but that's up to him to see. So would you please ask him?
yes, sir.
Just so. I don't want to get crosswise with, I don't want to hear that we got in the way of some other issue, some other program. So great, thank you.
We do have a member present who has their hand raised. That's, now is an appropriate time.
Oh. Yeah, is it online? Oh,
Yeah,
sorry.
it is.
Oh, yeah,
No,
sorry.
I'm checking
Sorry,
in
yeah,
with you.
yeah, oh,
before I
yeah,
kind
yeah,
of-
yeah, go ahead, yes.
Just a quick comment on all this communication is, Mrs. Byrne often responds by a letter. So, just a thought, we don't want, if she has questions, I mean, if she responds with a check, you get the check in the mail, that's fine. But if she has a question, it's going to be a letter. So making sure if it ends up on somebody's desk, it gets a timely response. That's it.
Thank you. Yeah, so I think for me, I would like a clarification from the town, from Ed, what this process looks like. What does he think this process looks like for him and the town, so that we can best align and be on the same page? Any other comments for implementation? Otherwise, I would say we can move on to the next bullet point of fall campaign, and we can come back to this implementation next month.
Thank you, Steve, for organizing all of that. It sounds great.
Yes.
It has been an honor.
All right, so we'll jump to fall campaign. Emily, I'll turn it over to you briefly for some updates from the nurse, from Nurse Connections. Yes.
Yes. So at this point, I just proposed that this topic be tabled until the August meeting. I did touch base with Jeremy and, we were not able to get a draft of the mailer to be presented for this meeting. He does anticipate that based off of his meeting timeline, and those communications, we should have one available for review at the August meeting. And I am currently in the process of getting more accurate, more pointed estimated costs, for the printing and mailing based off of the size that was, requested at the last meeting and the number of, parcels that would need to go out. So, and that way we can actually have a review of the expenses and the grants that have been approved to be able to cover those expenses. So everybody can kind of look at that and see what those costs are for approval or moving forward.
Great, I don't think we have to vote on that. I sounds okay with me. Does anyone have additional comments on that or feedback they want to add?
Just to, this is maybe too hypothetical, but a concern that, I mean, Jeremy took a very strong position at the last meeting about the draft that Cindy had come up with. And, offered to basically use existing Lebanon materials and, or I guess, get somebody at Dartmouth, I don't know where at Dartmouth, to draft something. You know, this mailing is about the Enfield program. And it has to have an Enfield. It has to go to an Enfield audience. It has to have an Enfield
Yeah.
look to it and
Yeah.
feel. And too much DHMC or Dartmouth Health, too much Lebanon. It should be under our control anyway. So I have no problem with him coming up with a draft, but I do have a problem potentially with him just deciding, or anyone in the Lebanon program, deciding what goes into our mailing. So it's just,
I agree.
I think he's open
Oh,
to.
hold on one second. Yeah, go ahead.
Can I just want to clarify, so I think with regards to the, I think we're talking about two different flyers.
Oh.
So the draft that Cindy put together was for a flyer for Enfield. But Rachel and Jeremy had said, and we didn't have it, I think, in front of us, although it's on the website, but they had added the Enfield number, Enfield logo or something to their existing flyer, so that's where
But
they
that's-
thought,
This one, right?
yeah, that's where.
But he said they're working on a one pager that he thought would substitute for the one
So I think
that I was
that,
proposing.
no, I think that flyer, so the existing flyer, the informational flyer, that's where we agreed to table the one that you had created. But then the creation of a new, talking to Dartmouth about creating a draft, that was gonna be for the fundraising.
There are two things that I think are in that aren't available yet. One was he said that there was one that had gone in the printer that was a one-page flyer. I don't know if that was for this purpose or not.
That's this.
Yeah, so
No,
that's okay.
he said there was one that was,
Yeah.
this is the one?
updated. Yeah, it was the
but we were
updated,
talking about a card or something.
right,
That's
that's
the
the mail
mailer.
That's
campaign.
mailer.
So that's the new
So
one that we
this one's-
created.
Oh, okay. I would like to bring up the flyer again, the one-page flyer for outreach purposes before we're done today.
So not for the campaign.
No, I just
Okay.
am mentioning that I want to bring that up because I misunderstood. I didn't know this,
So
because this is a foldout. I didn't think of this as a
Yeah,
one-page
so what
flyer
I-
for handing out.
from the minutes, what I understand is that they weren't sure if they were ever gonna be able to reprint that at the one point, like that they weren't gonna reprint that. We didn't have copies, and if we're gonna do outreach, we needed to give something. And so you had volunteered
Right.
for that. So that, but now that we do have copies, so do you still wanna talk?
I
There's,
haven't seen it yet. I've only seen this one. If there's something newer than this, I understand.
that's all they
No,
have.
that is what they were discussing.
Oh, and I definitely want to discuss the flyer again.
Okay,
yeah,
But I agree that I think our fundraising for the Enfield Community Nursing Program should look like it's for Enfield, not for MIH. And not funded by Dartmouth. If we're going to be asking people for money to support this program, I don't want it to look like we're being funded by Dartmouth because we're not. We're paying for nurses out of our fundraising right now. And hopefully the town will take over some of that or all of it in the future. But I just want it to look like our town program, even though we are paying for the nurses who are part of this program.
Mhm.
This is not us. This is a regional program.
Okay. Emily, you had something else too?
No, I
Earlier?
was just trying to pay attention to the agenda and our timeline.
Okay.
Cause that's a different topic than what we had listed.
So we're gonna table the fall campaign in general, because we need that. And from what I recall, Jeremy saying that they just wanna take the language that they have, so it's consistent with how they're presenting what the community nursing program is, and they're not, that language is owned by them, right? So what they're providing to the community, so to speak, so. So that's where that draft is coming from, so.
I understand that and I disagree with it.
Because
I'll just leave it at that.
we've also been requested to have the Alice Peck Day logo on it and there was something else, there was some other reason why the Dartmouth was going to be on there is because it is a part of the programming. So we aren't paying Dartmouth, but it is a part of the program that is being implemented, which is why he had said that in the first place, but. He also offered because they're used to creating things and having it flown by those agencies and having it approved by those agencies, so they're familiar with what those agencies are looking for to have the name on, including Alice Peck Day, because that is one of their partners. And so I think that he was trying to help us in that sense of they have people who are specifically paid for and tasked with those types of, projects and, so he was just trying to offer assistance. If that is not the way people want to go, then we're gonna have to think about what that means and who's gonna do it and how it's gonna happen. Cause it involves a lot of formatting for printing and other things that are involved with not just kind of yeah.
That's what I think we need to get on this.
Yes.
I don't know if in fact we see a draft of something in August, well then, is that too late to make substantial changes? I don't know. Let's say you started from scratch.
Yeah,
We looked at the
I
thing in
mean,
August and said, oh, we have to completely
I mean, if we're only looking at a card that's fundraising for Enfield, there's not that much we're gonna put on it,
yeah, I
right?
was gonna say.
It's not gonna be as complicated. We won't have a bunch of logos on it except for the town logo.
It
So-
will have the APD logo on it because of
Right,
the grant.
right, because they would be paying.
But we don't have any obligation to mention DHMC or Lebanon even,
No.
do we? As far as I can tell.
I would like to consider our community partnerships and how important that is to the implementation of our program. Feels respectful. But I don't know that it is absolutely necessary.
Yeah, don't know. It's always easier to debate these things when you actually have a draft.
Yeah, that's why, so I think we'll have to, unless we get something ahead of time, then maybe folks. If you are able to get something ahead of the August meeting, it'll give folks enough time to really put together their comments so that. It can be shared in the minutes ahead of time too, if not in the minutes, in the packet, if that's something that we wanna do. But I guess. If we don't receive anything by then we really have to start from scratch, so we have no other choice.
I should know by the time I'm sending you
Yeah.
informational items for forming the agenda,
Yeah.
whether I will have it or not. And at that point, I can say, I'm sorry, I don't think I will have it, or yes, I will. And
So it sounds like from what the committee is saying, if we don't have something to review, we'll have to make that August meeting talk about what that postcard's gonna look like.
Yeah.
And make some decisions in that meeting. Is that fair to everyone? Does that make sense?
Yeah, I think that's good.
yeah, because I think, if we have something to review, that still is plenty of time to get something to the printers for a November fundraiser, right? And
Yeah.
even if we start something different in August, that's still plenty of time.
we have to consider what the mailing process is up to that, which is part of my research, and the cost is to understand what the timeline is for when those go out and how
Well, we wanted them to get mailed in like somewhere around mid November, right? No, between November,
Yeah.
between Thanksgiving.
Yeah, because we
and
want people to
Christmas or
receive,
before-
we would have to, they would have to receive it in that time frame. So
before
we would have to get
Thanksgiving or
advised
between
when.
Thanksgiving. and
I think
Christmas?
it's,
Which did we decide?
I thought it was like the
Before.
week before Thanksgiving.
Yeah, yeah. Okay.
Yeah.
Around Thanksgiving, yeah.
So we
Alright,
would,
so that'll
we
give
would
us-
need to know from like the
Yeah.
post office, like, is that, you know, what the buffer of window is for, luckily it's local, but
Yeah.
still.
Right.
Yeah,
Did you get that, Emily, when, from talking with them before about what the time frame was for the time we would get the final copy of it to somebody for mailing?
I'm sorry, I'm not.
To get it to the, once we get it generated and the copies are made.
Mhm.
So what was the timeline for the posting of it? Do you remember?
No, that's what I'm saying. I'm going to
Okay.
review with them when I discuss the
Okay.
cost of the mailing is the timeline for if we
Okay.
want it to hit on this day. I mean, from when I spoke with Mr. Frack, it sounded like it was in people's mailboxes the same day.
Okay,
But I want to verify that with our post
Okay.
offices, also based off of the time of year, just because there
Yeah.
are a big increase in mailing, so.
yeah, so Thanksgiving is November 28th, so we want to be targeting any day on that November 17, 18, 19, 20, 21, 22. I think you get into the week of Thanksgiving and things get a little
Yeah.
hectic. So just so we have the dates. All right, so we'll continue to table this. I will jump into program evaluation now and then, so
Can I
we have,
make a comment?
yes, oh, says, yes.
Well, two comments. Number one, is there follow-up on the QR code? Because we don't want, when the card is ready, if Ed said there was gonna be some kind of follow-up to see if we could get a QR code. So I'm wondering to make sure somebody follows up on that. The other thing is I did notice, and I'm sure it's hard to see, but Amanda did have her hand up. So I don't know if Amanda wanted to say something.
I was just gonna say that Jeremy brought up the infield specific mailer in the MIH meeting a few days ago, and he said he would connect all of you via email, and it will be designed by Hillary, who is an infield resident. That's all.
Great.
so Emily, can you follow up with that on the QR code?
I'm
Is
working
any-
with Elisa on it
Oh,
actively.
Elisa.
It's. The QR code is the easy part. It's the other end of how and where the funds are received and how it funnels through that is the challenge right now. So, but yes, I will follow up with her again to see if we have any updates.
Thank you.
Thank you. Anyone, sorry that I should make it a point to look at the online audience as
I'm
well.
having
My
trouble paying
apologies.
attention
So
to, yeah, sorry.
just go off mute and be like, hello, we're here. No, I'm just,
Yeah.
okay, so let's go into program evaluation. So this came out because we're, what a big part of our task is also to look at the data and continuously evaluate the program. And then this will also help with hopefully collecting the information that's relevant to, or making sure that the information that's relevant to us is also relevant to some fundraising and campaigning and awareness. So we can just go through each of these bullet point by bullet point. I don't know, again, we might not, the essence of time, this might just be a starting conversation for this, but it would be good practice for each meeting to sort of look at the data and see, especially anecdotal info stories that we want to start collecting as Steve's preparing to submit these grants as well. So.
Okay, that's just an informational question.
Yeah.
Of Emily. So. Information that you get sent from Kristen. That you sent to us, do I have this right, is every month, this one page monthly report. And then quarterly, the graphs. Good, thanks. I'm just.
No,
I'm catching up with what's coming in.
It's one benefit of having our meetings a little bit later in the month is usually I can get you the most up-to-date information. So even if I received it last week, I can be including it in the packet, which, yeah.
So I guess we can start with that first question. How are we using data to understand the need for community nursing in Enfield? And I'm not sure who posed this question. So this was, I think, for a collection of meetings that we've had that we want to summarize. And I know the last part of here, the anecdotal info, I did bring up in the last meeting because, again, the data is great, but then the stories are also important, so.
I was wondering if we could just look at the data for June 1st,
Sure.
to begin with. Just on the one pager. It looks like there was only one home visit for the month of June. Is that correct?
Yeah,
I think we need to get working on outreach,
It's,
even for summer,
it may not be entirely outreach, partially because not every point of contact results in a home visit. So I can speak from experience of making referrals that I knew potentially fell outside the scope of community nursing, but I still felt it in best practice to start putting that towards them to make that point of contact with those individuals and so I did do follow-up on at least 2, possibly 3 that we had done
in June.
in the last 3 weeks, and I don't know if any one of those actually ended up with a home visit because all of them were point of contact typically via phone. Or the situation had kind of resolved in a different way, but I'm sure Amanda can kind of speak more to any of this than I can.
yes. Amanda, is that okay that we ask you about the home visits?
Yes. So partially, some of the hours for Enfield last month went to the Community Nurse Connection events, and there was an MIH team meeting, the quarterly meeting that happened as well. With the home visits and the referrals, some of the referrals that Emily and I discussed a few weeks ago, one patient is still admitted. Another referral was for someone who actually had VNA already in place. And so, as we see in other communities too, the number of home visits do ebb and flow. Some people were on vacation, some people were in Florida. So it's hard to look and say we only had one visit this month. It's more beneficial, I think, to look at the quarterly reports. And we are trying to prioritize the home visits. That's Rachel's area. She's doing most of them. She's out sick tonight, so I am covering. But I do know that I called multiple referrals already in the beginning of this month in July. I think across all 3 towns for July, we already had 13 referrals as of last Friday. So it's already a busier month. People are coming back from vacation. So some of it is the seasonal flow, and some of it is, like Emily said, we call and maybe they're not ready for a visit now, or they just saw their doctor and they want to do another visit in a few weeks. So there's a lot more that goes into it. I know everybody's working really hard on outreach.
So of the 13 referrals that you've gotten for what period of time is that? The 13 referrals you were just referring to? Those are
That's for the month of July. That's just the number of referrals that have come in. And that's not Enfield alone. That's Lebanon, Grantham, and Enfield. But I was just saying that to show that July has already basically been a busier month than June was, even after just the first week or so.
Do you know how many of those were actually from Enfield?
If you give me 1 second, I can pull it up. Sorry, I'm going to count the old-fashioned way. 1, 2, 3, 4, 5. So 5 from Enfield, and at least 2 of them were for the same person, who by the time we connected with her already had multiple services in place, including VNA. So she could be a home visit in the future, but that was someone that had received multiple referrals that when we connected, she was all set.
Okay, So that was 4 calls. Basically,
Um,
because the fifth one already had her services.
But these numbers that I just said won't reflect in what you're looking at, because I'm talking about July. I was just kind of giving you real time
Oh, I
data.
know,
Yeah.
right.
So I don't have the numbers now to tell you how many calls we made. I can tell you that I spoke to 3 or 4 people about the same person.
But the June, so just looking back at June, there were 13 encounters, right? And then you have it broken down. So there's only one home visit, but some of the encounters were phone conversations and issues were resolved in that without regard.
Yes.
Well, I'm just thinking of how it, I just think we need to reverse the trend here as quickly as we can, because, if we're trying to ask the town to support this, the hallmark of community nursing is home visits. And there are other ways we can contact people, but it's the professional nurse going into the home and doing an assessment of the whole situation at home, not just answering the one problem they think they have or the one question that they have. So I think it's really important that we, increase the number of visits. Maybe it's a fluke, but I just think it's, it's a cautionary tale. And I think outreach would help. We're not doing enough with outreach yet.
Are you hearing of people that need a home visit but aren't receiving what it is they need, or?
No, I mean, the whole reason for doing this is that generally there are people in communities that need, that can benefit from community nursing. That's why we started the program. The assumption is that it's going to be of use to people as it has been in all the other communities where we started. So just want to make sure that we're following through with what we've been telling people, because the pitch is, it's community nursing. Contact them and they'll come out and do a home visit and help you with whatever your issues are.
Emily, do you have the graphs available to display?
Unfortunately, just because of the way I have them on my computer, but I can't cast onto that
Yeah.
computer myself.
Yeah, no, I'm not sure I'd want to try it. That's fine. I have the Q2 data printed out. You probably do too as a pie chart, but the printed version doesn't allow me to make a comment about proportion of home visits. Oh, yours does, because you printed. Thank you.
Is, right, so as Stephen was just looking at the Q2, right, so 17.6% of the encounters were home visits. It looks like 46% phone, 36 coordination of services, and then 1.4 email. Is that, do you know, you may not know this off the top of your head, both Amanda and Kristen, is that pretty typical, that sort of breakdown of percentages of home visits versus, with other towns? I know everyone's, I'm sure there's variation from town to town, but is that pretty typical distribution of services?
I have my hand raised. Is it okay to answer?
Yes, please.
Yeah, so Community Nurse Connection, so the data isn't coming from Christian Barnum, it's coming from Community Nurse Connection, which Amanda and Rachel are entering, on a secure system. But the aggregate report, quarterly report, is posted on the Community Nurse Connection website. My husband would tell me it's not statistically significant, if you can get those words off. Steve will also tell me he hates pie charts. However, the percentage is about the best match we can get. So I always say to communities, if you want to compare your percentages, you can look at our website. Off the top of my head, I have no
Yeah.
idea, but some programs are bigger, some programs are smaller, but we're collecting data from 15 programs, so it's getting closer to significant according to statisticians. It's not 100%. But off the top of my head, I would just say each quarter. Now, the other thing is this is a new program, so they're building, so it's hard to compare a program at their 6-month point. It's probably easier to compare it after a year of data is collected, so that's kind of my short answer of, I'm not really sure, Donna.
Yeah, so, I mean, it sounds like this is a foundational, like, this is the building of the first data set, so to
Yeah,
speak.
yeah.
So I do agree that, where we can try to really, I think getting to the community and getting them to learn it is important. I think that's why we're planning to send that mass mailer. The campaign is not just it's not for fundraising, it's both. That's the whole point. That's why it's going to the whole town of Enfield. It's a way to reach everybody that has a valid address. So hopefully, that makes sense. I think in the next meeting, if we want to discuss other outreach opportunities, because I know we haven't discussed that in a while of going out into the community, then we can certainly discuss that. But outreach, that's gonna have to be that form. We're either gonna have to go into spaces where there are folks gathering already. I think our big attempt is going to be that mailer to reach a more massive group. But I think that can be a good conversation to have next time. And what does that mean for us? What kind of outreach are folks thinking about? What do you want to see this group do? What's upcoming in the next 6 months that we would be involved with? And in addition to maybe getting, it's also finding, I think the nurse connections are going out there too, so it'd be good to be in sync with that, so.
I also have one more comment just on Donna's question about the home visits versus the phone calls. For some people, it takes a while to build trust. So it may take 4 or 5 phone calls or even us helping them with one thing before they trust us to come into their home, especially people who are a lot more isolated or in hoarding situations. And so while we do love it, if people are like, yes, please come visit me, it often doesn't happen that way.
Yeah.
Yes.
Something on that, but before we go on to outreach, can I make a proposal looking far ahead? Yes, you're right, we're building this data set. I would like us to think about maybe the January meeting, January 2025, where I hope we would have 1 year's worth of data. Doing 2 things. One, devoting the entire meeting to data analysis, or at least as much as we can. And 2, inviting Kristen to come and help us think through it, since she has the broad perspective and help us compare what we're seeing with other towns.
Yeah.
I think that would be a good use of our time.
Yeah, yes, and also I think we need to have these kinds of discussions each time. I know we have to
Right.
move on,
Yeah, no,
because we need to build up to it.
not
Yeah,
instant.
we can't just, yeah, I think both. So I think, and a bigger meeting for that, and each of these meetings, this is great, because now we know, like, okay, it's important to this group, home visits, so. Yes,
Jeremy has noted previously that after 6 months, they turn their data over to their statisticians and, visual people, and they actually do have a 6-month report that will be brought to us that analyzes all of that data. So that actually should be coming forward, if not by August, by September, we should have at least 6 months of data that has been analyzed to kind of bring forward. And they will do it annually as well. Every 6 months, that's what we'll get.
Okay.
So it may not be January on the dot, because it'll be including all of the December information, but it will be brought forward in 2025 for the first full year.
And I just wanted to Steve's point, I think that's really will be important thinking of January, because I don't know when things have to be in for the March, town meeting, right? But I'm sure that we'll want to have some kind of information because we're having just the general proposal in 25, right? And so
That's right.
you know, I'm sure people will want to have some kind of information if they're going to vote to keep, to adopt this as a town, program, even though it's not officially incorporated into the budget until 26, to know if it's effective.
You're 1 year ahead of us. We're
20
proposing
is the general,
26 is the general, what, I'm sorry, I'm not showing.
right?
So not necessarily for, we wouldn't be asking for money from
Money,
the town
right,
at
right.
this next meeting that comes up next March, but we would want to have information about how the program's going.
Right,
Right,
Just,
yeah,
that's all.
Exactly.
Yeah,
Yeah,
sure.
we don't, yeah,
for sure.
exactly.
All right, well, we are at 6:30. I think in the next meeting, it makes sense maybe to start with anecdotal information and start thinking about what that means for each of the committee members, on this evaluation, program evaluation. We'll have to, so we'll move on to other business. We'll have to, Cindy, if you want to just make a comment about the flyer so that
Yes.
we can log it, yes.
I do. So I made the corrections, well, I made the correction without having, multiple falls in the home. And I just wanted to speak to the, residents who can no longer get out of the house. That's purposely, worded, it's no longer getting out of the house, so it's not like they always have been homebound, but this is a recent change for them. And I would say that the people who can't get out of the house are at pretty high risk. So I would leave that kind of open-ended that way. Because generally there are some issues there that they may not think are a problem, but a nurse going in could see that that was a problem. So I wouldn't want to take that off the list.
So what do you propose this flyer? What are we thinking about what this flyer is going to do? This
We're
is
just gonna do,
because we're gonna have we have two we have a mailer that's campaign. And then we have a flyer that's a brochure that goes out when we have events. So what is the purpose of this one?
This is the flyer for events. But when we talked about doing outreach, I talked about going to, like putting up a table at Dunkin' Donuts or going to meetings of local groups to just see if they have any questions about the community nursing program, make sure that they know about it and just the basic stuff that's on here, which is very, very basic. And how to make a referral.
So then I suggest then when we meet next month about talking about outreach, then this can be a part of the discussion.
Because last time we voted, I don't think you were here, Cindy,
No.
last time, but there was a vote to table this because, and to use the flyer that already that is already available for the community nurse, so yeah, this sounds like.
We don't have a flyer available right now.
It's the
So
one
we're
that's
using the
currently.
flyer
used.
interchangeably, but I
Right.
think that's getting confusing.
Right,
You mean this,
yes,
this one?
Yeah.
But that's not available right now.
It's available online, it's available in
And-
town offices. Where are you looking to have it available?
I don't want to use that one.
right,
Okay,
because
that's
it's all
personal
about the
preference
MI.
versus
No,
availability.
it's about, this is a community nursing program for Enfield. And I don't want to be, when I'm telling them about, this because they may know of a neighbor or a family member, I want it to be very personal and very Enfield oriented. I don't want to give them something that has, all this other stuff on it that they don't need. All they need.
So we'll
to
need
know
to
is
table.
what-
We'll need to-
Under what circumstance, I want it to be friendly, easy to read for people who don't read very well, or maybe their eyesight isn't good, or someone's having to read it to them, or people who are not very well educated. I just think we should have something very simple that just outlines the program for Enfield, because that's what we've asked for from the citizens whenever we've met with them.
Yeah.
Up to this point, is that we wanted a community nursing program for Enfield.
yeah, so I think that'll just have to be the next, for next meeting.
Okay,
Right.
then we're,
We'll have to, we're over time, but also we'll have to, that's a longer discussion then.
Yeah.
So. Also, we'll just punt the other item for community nurse meeting attendance. We don't, any public comments, any other comments from online?
Two quick comments. If you need more brochures, let me know. I can reach out to Hillary and get some more printed. So she's an Enfield resident who is at Dartmouth Population Health. So if you need any, just email me the amount and I can get them printed, and I can get them either to you directly or to Emily. The other thing is there is confusion, as Emily said, about a brochure and a one page. I think it would be nice to have something to post on some of the community bulletin boards that is one page, bigger font, easier to read. So just kind of part of that, but please email me if you want brochures. I can reach out to Hillary directly.
Thank you. All right, so I think that also we have a robust agenda for the next upcoming meeting. Does anyone else have any other future agenda items? If not, you can send that, ahead of next meeting.
I just wanted to say that I had requested that we keep the video of the meeting that I missed, and it was great. The link worked perfectly, and it was very clear. So for any time the program's not working very well during a meeting, like if the volume's not working or if we can't make the connection, it's a really great resource.
Great.
And I was able to go back to it to look at, to refresh my memory about one of the conversations before coming tonight. So, I'm very much in favor of that.
Great, glad to know it's working on our favor. All right. Well, I moved to, it's 6:30. Yes,
Just one quick,
Yeah.
the community nurses are hosting, Amanda, I apologize, is it tomorrow or Friday at the library or behind the building?
Tomorrow at 11, I believe, at not the library building, whatever the other places that the thing is happening. Sorry, I don't have the invite open in front of me.
I know that the Enfield Library has had flyers out on their desk. I know that they've posted to Facebook. I know it's been shared with other agencies, so.
What is it? What is it?
Community meet and greet for community nurses, and the event people have kind of questions or want to know more about the program.
So
So where's the
town?
information?
are we talking about in Enfield?
Yes,
Do you mean the
so in Shaker Hill, like.
building behind the library, which used to be a
yeah,
chapel?
yes.
That's now called a performance center. For what
All
it's
right.
worth. Go ahead.
If there's if there's a poster, can we just send it do you have a poster, Emily? You could just email to everyone.
It's a post on
Oh, it's a
Facebook.
post.
That's what I was
There are
trying
link,
to,
yeah, so we could
That's
just
where it was published.
send the link to folks. All right, well, it is 6:37. I move that we adjourn this meeting and pick up in our next meeting on August 21st.
Second.
All in favor? All right, if not, stick around. Thank you, Kristen and Amanda. Yeah, I thought I saw something in the library. I think the library's doing a whole bunch of meet and greet